And so looking at batter technique, very similar to Dr. Isaac's, we see that with kinematics, we've studied what the potential golden technique is by observing professionals, by looking at things such as the elbow angle at contact for straight drives and how this may relate to performance, bat speed. However, we see there is amounts of variation within professionals. For instance, these two professionals here, both elite cricketers at the height of their country, Steve Smith with the more open lateral bat lift technique, and Virat Kohli with the more traditional, if you will, straight bat lift batting technique, which is found in coaching manuals. And equally, when we look at female cricketers, we find they have different batting kinematics, leading in a straight, lofted straight drive, where they have a more flexed elbow and use more wrist uncocking in order to generate the bat speed, which I'll go into later. And so we need to look at more of an individualistic approach, I believe, and how we can measure this aside from just the joint angles and look at what is producing the motion. Part of this is looking at the demands on cricket batters, not only supreme visual systems to take up a fast ball coming in at less than half a second, moving at 3.8 centimeters a millisecond actually, which I find quite fascinating. Therefore needing neuromuscular control, moving into pre-programmed motor control patterns from years of practice, but also reacting to any deviations of the pitch, which is prospective motor control. For this, we need supreme cognitive centers and physical conditioning, which is actually believed to be one of the main differentiators between performance, batters of equal skill. And so, looking at strength studies in correlation to performance, we see that there is some performance that has been predicted from measuring isokinetic strength measurements of internal-external rotation, as well as knee flexor extensor. Believed knee flexor extensors for sprinting between the wickets repetitively, whereas isokinetic shoulder rotation is the internal rotation for prolonged periods, as well as high-speed generation. And this was linked moderatively successfully to provincial cricketers in South Africa for success through the next season. Equally, ball carry distance has been increased from a bench press training program. However, this did not correlate with performance. And so we see there is the potential for an increase in performance related to strength, but the exact mechanisms aren't understood. So what's important for bat speed generation? We all know ball carry distance is important. The further you can hit a ball, the greater your opportunity to hit boundaries. And so Michaela Naylor et al. Found that ball carry distance and bat speed generation are found through a logarithmic equation. So ball carry distance due to ball launch angle, ball launch speed. Moving down, this is found to be due to bat ball impact location on the sweet spot, as well as bat speed at impact. If you generate more bat speed, you can cause more results in ball speed. And this is found due to the X angle, pelvis thoracic rotation, elbow extension and wrist cocking to generate the final layers of bat speed generation. And so we know that there are important movements related to bat speed generation occurring in the lead arm. There is the potential for strength implications. And so first we need to understand what demands are occurring in this area. And so I'm taking a slightly different approach, looking at a sample of 10 adolescent cricketers in South Africa, looking at the muscle activation, which is MVC%, which I'll explain further in the next shot, replicating a study by Michaela Naylor looking at lofted straight drives, with the independent variable seeing if shot type differs with muscle activation. For instance, my main characteristic was lofted straight drive, but also batters then would fail to produce this performing a straight drive along the ground or cover drives. Also looking if there's a difference between participants. Does each person have their own technique, or is there a golden pattern shown for batters that we can prepare them for? And then over the different shot phases, what are the demands occurring in the lead arm? So as mentioned before, I'm looking at electromyography, which is the electrical signal in the muscle from the cerebral cortex. This can be measured in millivolts. So if we have a maximum in batting of 3 millivolts, and at the moment of contact, a batter is producing 1 millivolts, see the percentage of 33%, showing the amount of demand, if you will, averaged over the batting phases, which is taken from prior kinematic studies. We can see the moment of contact of 0.01 seconds, providing an instantaneous average, if you will, over each batter. The muscles measured, I chose to use those important for elbow extension and wrist uncocking, linked to bat speed generation. So elbow extension being the bicep, tricep, and wrist uncocking the forearm flexor and extensor muscle groups. These are some of my results. To orientate you, if you move down the rows, you move from the different swings. So from backswing phase into downswing, contact follow through. Move across the columns, we see lead elbow angle, and then the different muscle characteristics. So we see if we move from backswing, there's a more flexed elbow, more forearm extension, possibly due to the cocking of batters of the wrist in order to lift up and generate the bat speed. Moving down, we see in downswing the flexion of the elbow, moving forward to generate the speed by extending into contact, and increased muscle activation, particularly in the forearm groups. At contact, the highest amount of activation. This makes sense. As we move towards the shot, we need more muscle activity to generate this bat speed. But of note is the forearm extensor and tricep being the highest amounts of activation, possibly linked to the elbow extension and either wrist uncocking or bracing of the forearm for top hand control. And then in follow through, dissipating of the muscle activation as batters gather the bat over their head. So important to note there is that the forearm extensor has different amounts of activation in each phase, showing it has unique characteristics of demand on this muscle group. And the tricep has rapid peak from downswing into contact. Some comparison of my study to prior studies is the lead elbow angle. So adolescent male cricketers were found to have similar elbow angle at impact compared to the elite professionals, over high amounts of variation. And so we see with decreased experience or decreased playing level, there's maybe a high amount of variability. And also the difference in kinematics to females are already present at adolescence, meaning there's further research needed there to see where this is occurring and why. In the backlift technique, we have the lateral backlift technique aimed at second slip, or the straight backlift technique, such was shown by Virat Kohli, which is SBBT there. We can see a more flexed elbow, high amounts of forearm and tricep activation, possibly due to the flexion in order to generate the bat speed moving forward. So some patterns that I found across all participants was that at backlift, there's a small amount of variation. All batters start from a very similar point with a similar elbow angle. Moving into the downswing, there's a large increase in muscle variation and muscle voluntary contraction percentage. At contact, there's the highest amount of muscle voluntary contraction, also the tricep peaking, but there's also a high amount of variation. If you see there in the red, my coefficient of variation of 8 to 71%, the 8% seeing at backlift, so a low amount of variation between participants, but moving forward as they adapt to the different deviations of each ball, even though you're using a bowling machine, there's a slight amount of deviation. There's a high amount of variation. So this may be due to the high variation seen in cricket by my participants or due to the inexperience. So I looked at some of the significant differences found in participants. A bit blurry, but you can see here participant 8 has a unique lead elbow angle. The uniqueness is that it is more flex throughout the duration of the shot as compared to participants. See there's maybe the backlift technique, it's very much open stance, a little bit of cocking. This can be shown further in this graph. You focus on the green line, that is the participant. You can see a more flexed elbow there, leading into the shot with less extension. The other gray lines are the other participants in the study. This is the lead elbow angle measured by goniometry. You can see the different phases, how it cocks into downswing and then extends into contact. At the forearm flexor, we can see this participant also had a lower amount of forearm flexor activation. You can see a lot of rotation around the chest for this participant, possibly their mechanism for generating bat speed in the lofted straight drive. This can be seen here by the blue line. You can see a lower average over the total shot. Also with the gray lines, you can see a high amount of variation occurring here as the different batters take their different pathways to accomplish their goal, or possibly just different neuromuscular control mechanisms. You also see how it increases from downswing to contact rapidly, decreasing into follow through. Finally, participant 9, also the only left-handed batter in my study. It's unclear if this is due to being left-handed or his own characteristics. More studies need to be done. We see a low amount of forearm extensor activation, making him different, even though there is a high amount of cocking in the back swing. And so we move forward, we can see the red line here, the lower average overall. Also of note for the forearm extensor, you see the higher activation in the backswing phase and into the follow-through phase as they resist the bottom hand, finishing in the checked follow-through. And so some of the findings for my study are that there are unique participants, and this may explain some of the variability amongst cricket batters and may promote an individual approach to how we assess their batting technique and promote their performance moving forward. The forearm muscles have high activation, maybe under greater demand in cricket batting, which can be linked to overuse injuries or in certain cases where batters have picked heavier bats and caused lateral epicondylitis, tennis elbow. The tricep has a rapid peak in muscle voluntary contraction, may be important for elbow extension generation, so high speed production of force. And although the individual technique explains some variation, there is still a large amount of variation. More studies needed to be done. And so my recommendations moving forward are a greater sample, to include female cricket batters to understand what is happening within their sample, the demands of their game. A reliable bat speed measure. I did use bat speed, however, we haven't been able to get the data to see if it's correlated to different muscle activations. And possibly a resistance training program, pre and post measurements to see if this links to muscle activation, bat speed, and if it changes the muscle activation patterns of batters, or if it can enhance the technique if it is related to their performance. Thank you very much.